Well, there's quite a lot of information given on that very last day, and moms tend to feel quite overwhelmed. It's easy to forget a lot of it, and I have certainly seen that in my practice. I let the moms know that before you leave the hospital, you'll be given a rota health chart or a neonatal or baby chart, discharge chart, and this is really important to keep this somewhere safe because you will be using this very often when you go for your clinic checkups, which are probably going to be once a week in the beginning to check your baby's weight and to see that feeding is on track. And then you're going to be using this chart for immunizations. And it is important that you immunize your babies and that you follow that protocol because it's been very carefully put together to protect your baby against deadly, life-threatening diseases. The first immunization will very often be on the day that you leave the hospital, and that will be your BCG, bacillus, your TB immunization. And what they do is they'll ask if your baby can be immunized, and it's important to give consent to that. They will then put a tiny, tiny needle just under here in the deltoid area, the upper arm of your baby, and they will inject a little bit of live TB bacillus, really. So what they're doing is they're giving this little bit, and in a couple of weeks you might see a blister developing or a bump on the arm, and most parents are tempted to squeeze that or put a dressing on or interact or do something with it. Please don't ever touch that area. Obviously if you touch it, it's fine, but don't touch it in a way that you're messing around with it or impacting on the healing, because it's meant to go like a blister and to raise. And when that injection is given, it's, as I say, it's just slightly under the skin. It's going to do that because it's working. So that is your very first immunization given in hospital very often. If it's not, you'll be asked to come into the clinic, but it's given early on. You can also expect on the last day to be given some discharge medication and some advice on what to do if you have pain. Follow that advice. Take your medication as prescribed because those medications are going to allow you to enjoy your baby. Don't stop taking it until you're finished the course, especially if you've been given an antibiotic or anti-inflammatory. Take it for the required time. You will also be asked, have you got a car seat ready in the car? And parents sometimes don't even think of getting a car seat. They think it's safe to hold their baby in their arms and go home. But even though you might be the most superb, brilliant driver, there are drivers on the road who can easily knock into you, or an accident can happen to anyone. Your baby is going to go right through the window screen. Please make sure that you've got a car seat and you've learned how to use it, especially for that last day. So when you leave the hospital, especially the partners know how to take the baby and put it into the car seat. You don't want the added stress of figuring that out in the car and saying, just leave it, because it's important to put your baby in a car seat. On the last day, if you've had a cesarean section, you should be given stockings, these gorgeous white stockings up to the top of your knee, and these are deep vein thrombosis or anti-clot stockings. They're to help with circulation. I would advise you to wear those stockings. Ask someone to help put them on. It's very difficult to bend down for as long as you've been asked to, and to stick to it. A lot of moms don't want to wear them because they're uncomfortable, but they are important. You also need to look into the kind of exercises that you can do that are safe, and we're really just talking exercises where you wiggle your knees up and down, where you move your ankles around, a bit like the ones you do on the aeroplane when you're flying long haul. Exercise class can start after your 6-week checkup, so don't do anything that's going to get in the way of you healing, especially if you've had a Caesar, because you want all those layers of suturing to heal. And make sure you've asked your doctor before you go home on that last day, how do I manage the wound? Many women go home with a dressing on. They come and see me 2 weeks later, the dressing's still on, it's almost grown into the skin. Ask them, can I take the dressing off? Day 5, day 6, day 7. What do I do when I've taken the dressing off? You should be wearing underwear that's high up, those gorgeous granny panties. You should be wearing those. We don't want any of your elastic of your panties to rub into the wound and irritate it. Moms often ask me, can I wear a belly binder? We wouldn't advise with a Caesar to wear that too early. It can definitely hurt you, first of all, and if it's too tight, it can cause damage. We want the wound to heal well, and especially to air once it's open. So those type of binders, check with your doctor at your next checkup and see what their advice is. If you've had a natural birth, you might be a bit tender down below. You're going to want to ask the staff, how often should I do a Sitz bath? And a Sitz bath is really where you just put salt into water, make sure it's the right kind of salt, and you go into the water after you've had a wee or poo, and you have a little bath, and you come out and you just pat dry that area. Or if you have a hairdryer, I know the thought of it, but put the hairdryer on and just air that area a little bit. Don't put it on too high. We don't want you to burn your precious bits. Do make sure that there's no heavy rubbing or that you're using a nice soft toilet paper, because we don't want you to irritate the area. Moms do often struggle with thrush post-birth if they've had a lot of antibiotics and they had thrush before. So you may need to ask the doctor to make sure that when you go home you've got a cream, a script for, I won't name a specific cream, but an antifungal cream that would treat thrush. Check with your doctor about that and make sure that your panties are cotton and that you change them regularly. And when you do wee, that you spray with your spray bottle and keep that area as clean as possible, because that is going to help for healing to take place. Moms are very scared to poo when they get home. So when you're discharged from hospital on that last day, they might ask you, have you pooed? And if you haven't pooed, you need to let them know, because we don't want you to suffer from constipation. It can definitely impact the healing of your stitches if you have any. It can certainly make hemorrhoids worse, and it can also be very painful for the mom and uncomfortable. So when you go home, ask your doctor if they would write up a stool softener for you or something to help you to go. So when you do go, it's soft and you don't have to worry. And then again, run yourself a bath. If you're scared to poo, you can even get in the bath when you poo. Don't tell anyone. And then get out, and then everything is going to be a lot easier, but never hold back from going to the loo. On the last day when you leave the hospital, make sure that you've got all your papers signed if you're applying for UIF, Unemployment Fund, or if you have got any birth certificate that you need to get done at the Home Affairs or at your consulate. You need to see that all that paperwork is done while you're in hospital, so you don't have to drive back on another day. And usually it's just a letter that says your baby was born on that day, and the registered midwife or doctor needs to sign that. So check with the hospital what the policy is, because some of them will do that for you where they register the birth. But most of the time you need to do that outside of the hospital and check that that's done within the required time frame. So if you're watching this and wonder what you need to do for that last day, it's the car seat, get your script for pain medication, make sure you've had a poo, speak to the doctor about wound care, and if you're registering your baby for a passport or just for an ID, that you've got all the paperwork done beforehand. So when you get home, everything goes much smoother. Before you leave the hospital, it's ideal to speak to the lactation consultant and just make sure that you're on track with your feeding, so you don't go home and then realize that you're struggling. So try and do that all in hospital. You'll also need to find out where your closest baby clinic is, or who is going to be immunizing your child, because when you've left the hospital, you've been given one immunization, but thereafter you'll be put onto a program which is worldwide to protect your baby against diseases. And that usually starts with the first set of injections at 6 to 8 weeks, and then another set at 12 weeks, another one at 16 weeks, and thereafter there'll be boosters and follow-ups at 6 months and 1 year. Try and find out which baby clinic you are closest to, because it's always great to be convenient, but also see if the sisters there are very, very knowledgeable when it comes to breastfeeding, and if they promote breastfeeding and are able to assist, that would be helpful when you go in. Most pediatricians in the hospital will ask to see you for a follow-up, and most doctors, especially if you've had a cesarean section, will ask you to come back in either at 1 week to check the wound, and definitely at 6 weeks to see that healing has taken place and that everything's on track. You need to make certain before you go home that you feel comfortable with who you're seeing, with what the plan is, so that you're not sitting at home thinking, where to next? And once you've found those things out, it should be much easier those first few months. Before you leave, ask the staff in the nursery if they'd be happy to show you a baby bath demonstration. It won't always be on that last day. It might be on the second day if you're feeling up to it. But at some point in the hospital, it can be helpful to ask them to show you. And remember, you can bath your baby however you wish. But for first-time parents, it's often really helpful to know how to wash the eyes. Do you put it in or out? And just for the record, it's in, out. How do we wash the hair? Do we need to wash the hair? Absolutely, you can wash the hair. And it's great if you can hold the ears and hold the baby a certain way and ask them to show you what that certain way is. And if you get home and you forget how to bath your baby, you can fill the sink up. Make sure you feel the water. Shouldn't be too hot or too cold. And just dunk your baby in. If they've had a big poo and it's messy, you can always do that. It doesn't have to be exactly how they've shown you, but it often increases your confidence that you know. So in summary, make sure you've been shown a baby bath. Make sure you know the baby's immunization schedule and where you'll be going. Be certain that your wound has been checked and you have follow-up instructions for that wound. Go home with your pain medication and finish them, and make sure that all your paperwork has been done in case you need it for later. There are times when you may arrive home and things aren't quite going according to plan. And when I say according to plan, we know that you've been informed you will bleed, and you've probably been told that you can expect to have some soaked pads and that will slowly decrease. So over the next few days and few weeks, we would hope that that discharge would become less and that dark red blood would get a little bit lighter and perhaps go a brownish color and then disappear. So if you're at home and suddenly you are gushing blood or passing large clots, this is a sign that you need to pick up the phone and call your doctor immediately and let them know what's happening. Or you need to ask someone to drive you straight into hospital. So we can expect some bleeding, and certainly it can increase at times when you're feeding. Remember, we said the uterus contracts and you can expel a little bit of blood and it can gush. But if it's running down your leg and soaking through the pad and it had already slowed down, we would want you to get help then. Another warning sign that you need to be aware of is if your temperature starts going up. A normal temperature in an adult would be anything from 36 to 37.1. It might be slightly higher in the evening, but we do find that moms that go home and get a temperature often are so busy with feeding that they think they're just a bit unwell, or maybe this is just how it is because they're tired, they don't pick up on it. A temperature in a mom post-birth is always a sign that there's a possibility of infection somewhere. If it's in the breast, she'll probably notice a hard area, or her breast will be very, very sore and warm to touch and not draining well, and that is something that we would want you to get intervention earlier rather than waiting. There are a lot of natural methods and alternatives that moms might like to try and feel more comfortable trying, but the truth is, if mastitis, infection in the breast, has not resolved or got better on its own in 24 hours, it would probably just get worse. And if that happens, you will need an antibiotic and a visit to your doctor. So if you do notice your temperature going up and you have pain, particularly in the breast, it's more than likely could be mastitis. And the treatment there would be to feed, feed, feed. Drain that breast as well as you can. Let the baby feed. You can use a little bit of heat, not too much. We don't want to cause the breast to be more inflamed. So some heat before the feed, and after the feed, a little bit of coolness. Maybe even frozen peas out of your freezer wrapped in a cloth. Or if you don't have a really nice cooling gel or one of those ice blocks that you can put safely on the skin, you can just make one. And then if the feeding isn't helping and the Panado's not helping, you can take 2 Panados, no problem, or 2 ibuprofens. If this isn't helping and it's getting worse, you need to go to your doctor. Another thing to look out for is if you're short of breath suddenly. Of course, you might be tired and say, I'm just short of breath because I'm a bit tired. But shortness of breath in a mom post-birth, and also that has had a cesarean section, would always lead us to be concerned. And what we're most concerned about post-birth is those moms who have had a cesarean, perhaps haven't been moving too much, and especially in moms who are perhaps obese, there are a slightly higher risk of clots. And this is where we would encourage you, if you have a hard or sore area on your leg, or if your feet suddenly become very, very swollen, or if you are experiencing shortness of breath, to go straight into hospital or to speak to your doctor immediately. For moms who have blood pressure problems, who have very, very severe headaches, particularly frontal lobe headaches, and those headaches are getting worse, and the swelling is getting worse, and they're just not feeling well, that's still a warning sign as well. Anything that doesn't feel right probably isn't right, and I'd urge you to get help quickly. If you've managed to find a lactation consultant early on in your pregnancy that you've developed a relationship with or had a consultation with, keep their number on your phone. So if you're not doing well with the breastfeeding, or if you're struggling with sore nipples or bleeding nipples, you need to call them immediately. Rather get help sooner than later.